Hello, welcome back to part 2 on our series of grief and emotional processing. My name is Rachel Nelson and I'm a FEMA community liaison with the Colorado Spirit Initiative. Today we're going to talk about 4 normal reactions that we have to grief. As we mentioned before, grief can be associated with the death of a loved one, a traumatic event, but with the pandemic we've experienced other types of losses as well, the loss of a job or the loss of friendships due to quarantining and social distancing. The 4 normal grief reactions can be divided into 4 parts. We have emotional reactions, physical reactions, cognitive reactions, and behavioral reactions. For emotional reactions to grief, we can experience sadness, numbness and shock, anger, guilt, anxiety, fatigue, helplessness, loneliness, and we can even feel relief, and then we can feel guilty about the relief. For physical reactions to grief, we can experience chest tightness, feeling out of breath, muscular weakness, dry mouth, loss of appetite, insomnia and trouble sleeping, and a feeling of a hollowness in the pit of the stomach. Some cognitive reactions to grief we can experience includes a phenomenon called grief brain, and we'll talk about that more in our next video. But for right now, it's more of a excessive forgetfulness and maybe feeling overwhelmed with choices. We can be obsessional thinking about the loss. We can experience confusion and even passive suicidal thoughts. Behavioral reactions to grief can include avoidance of memorable places, social withdrawal, absent-mindedness, restlessness, crying, and excessive sighing. With the pandemic, you may be experiencing more behavioral reactions to grief, especially being socially withdrawn, as experiencing connectivity with others may feel more fatiguing right now. So let's check in with yourself. What emotions have you been experiencing this last year? How would you describe the physical sensations you have been feeling? Have you experienced grief-associated cognitive changes? What kind of new behaviors do you notice yourself doing? I know for me, I can just about check off every tick on those boxes on the 4 normal grief behaviors. It has been a rough year, and grieving has been a process that I have been through many, many times. I also know for myself that when I experience those things, it can be uncomfortable, and sometimes it just feels like you need to survive to the next day. So what we're going to do now is practice a coping skill called mindfulness. Mindfulness is a technique that helps you build self-awareness to help you understand and take cue of the different kinds of symptoms you may be experiencing with grief. And it's being self-aware of how your body is reacting will help you in the healing process later on. So right now, take a seat in a comfy chair with your feet on the floor. Close your eyes and take slow, deep breaths. Take notice of the air filling your lungs. Hold your breath for a couple of seconds and then exhale slowly. Pay attention to how your body feels. Is there any area that feels tense or tight? How fast is your heart beating? As you recognize how your body is feeling in different areas, learn to relax those areas. Whenever you feel overwhelmed or have a lot of stress or feeling the waves of grief, take the couple minutes and do this throughout your day. Thank you so much for taking your time to join us again. We're looking forward to seeing you next time when we talk about grief brain and pandemic-specific loss. We wish you a happy and restful week. Thank you for joining.